Part of the challenge in addressing non-adherence is the complexity of our system, so that we have a concept that, well, we give a patient a prescription and they take the medicine or don't. And in actuality, the process of getting a patient on a medication is much more complicated. First, the patient and their clinician need to meet. They need to agree on taking a medication, and sometimes that discussion doesn't happen with the depth that it might. So even at that first stage, there can be problems of either poor explanation by us as clinicians or lack of understanding by patients of the disease or the treatment. Then the process needs to progress to the pharmacy, where clinicians need to get information to the pharmacy, sometimes electronically, sometimes by phone, decreasingly often by paper. Patients need to get to the pharmacy. At that stage, there are complex interactions with patients' health insurers, how the medication might be covered, if there are changes needed, as well as very important safety checks that a pharmacist may do. Multiple steps in the process before a patient can fill a medication. And then the patient at home needs to keep taking it, needs to return to their clinician, needs to understand over time the importance of staying on the medication. So when you start mapping out what it takes to get from, to take an example of high blood pressure, the first time a patient has a high blood pressure recorded in their doctor's office, to get through to the stage where the patient is taking effective medication in the long term that keeps their blood pressure controlled and reduces their risk. It sounds simple at first. The blood pressure's high, we'll make it lower. But there are so many steps in the process, and each of those is an area where we lose some patients from medication adherence. Lack of understanding maybe of the diagnosis, lack of belief in the medications, complexity of the system, cost of the medications. Each of those can be a threat to adherence, and figuring out how to address those effectively for each individual patient is really the challenge that we all face at this point.